All right. Good morning, everyone. Good morning, Queensland. So I can report that we have had 5 new cases overnight. So 2 are overseas acquired, detected in hotel quarantine, and 3 are locally acquired. So this means we have some good news today and some not so good news. So I just want everyone to bear with me as I go through it. It's a little bit complicated, but I think we've got a way through. So one is the partner of yesterday's airport case. So quite comfortable about that, but our contact tracers still need to do a little bit of work there. Now, there's another 2 that have just popped up this morning. It's a mother and daughter from Carindale. They got symptoms and were tested yesterday, and they have been out quite extensively around Brisbane. So we really need our contact tracers, and this is the advice of Dr Young, to really get on top of this issue quickly today. So I want to thank everyone who's come out and got tested. So we've had 26,993 tests in the last 24 hours, and we've had 17,436 vaccines in the last 24 hours as well. So that's really good. So what does that mean? So I really need people to listen to this, because it is a bit of a mixed bag, but I think if we all do the right thing, we can get through this together. So the lockdown tonight will end for the following LGAs. Okay, so I'll go through them. Noosa, Sunshine Coast, Ipswich, Logan, Redlands, Gold Coast, Scenic Rim, Lockyer Valley, Somerset and Townsville. But there will be restrictions that will continue to apply, and those restrictions will be in place for the next 2 weeks. That means everyone will have to carry a mask on them and wear that mask whenever they're outside of their home, but of course not when you're driving your vehicle. But obviously that means going to shopping centres, hospitals, aged care facilities, churches, everywhere else. This is our added protection at the moment until everyone gets their vaccine. Okay, now secondly, because our contact tracers need that extra time, we need another 24 hours. So I'm really asking people in the Brisbane City Council and Moreton Bay local government areas, the lockdown will continue for 24 hours. Now, we will come back early tomorrow morning once our contact tracers get on top of this, and we'll look at the case numbers overnight. So I want to thank everyone for doing the right thing, but as you can see, we've just got a situation at the moment that has just come in, and we really need to give the people, our contact tracers, the time to do that. So Dr Young will go through in a bit more detail where the mother and daughter have been. It's early days, we'll get more information during the day, but it is absolutely vital that we get on top of this today, everyone. So I'm just asking for that extra 24 hours. And the final thing I'll just say before handing over to Dr Young is that at National Cabinet this morning we are asking for that reduction in overseas international arrivals. Our hotels are stretched. We are basically at capacity. And the Deputy Commissioner will give the numbers on how many we're at, but we are at that capacity. We're stretched. We need an immediate reduction by 50%. So I'll be raising that this morning at National Cabinet. So thank you everyone for doing the right thing. Please stay safe, and I'll hand over to Dr Young.
Thank you, Premier. So yes, we have 3 locally acquired cases overnight. So one is the partner of the woman who worked at the Qatar airline counter, and he is the index case. So he's acquired it at the airport and then given it to his partner. I have the whole genome sequence result on the lady, and she has the Delta variant. It is not clustering with any known case in Queensland or Australia, and on the international database it looks like it's closest to some cases in India, but we just need to confirm that. So it looks like the gentleman who's now the new case acquired it, probably from international airline crew. He's a luggage handler at the airport, so we think he's probably got it from international crew, given that there's no clustering with any known Delta variant case in Queensland, and then he's given it to his partner. He has now recovered, so we picked him up on serology testing. He's got neutralising antibodies, so we think he's recovered. Now, we already, of course, had done contact tracing because we were always concerned that he might be positive, so we can immediately activate that today and get in touch with all of those people. Then 2 new cases that have come in overnight. At this stage, I don't have any information on how they're linked to any other cases, so we'll work that through today. They're a mother and a daughter who live in a household, so we're checking the other people in that household to see if they're positive, of course, and we've started the contact tracing. Now, I have some very, very, very early information which I will share with you, but as we have further discussions with these 2 individuals, we'll get more information and we'll be able to clarify. They've been extremely helpful and given us some very useful information, so I will share it. So they were out at the Harris Farm Markets at West End on Sunday the 26th from 11:50am till 1:50 p.m. And then they went into the Woolworths in that same complex at 5 minutes after that period. Then on Monday the 28th, they spent most of the day at the Greek Orthodox Community Centre. Tuesday, again, most of the day at the Greek Orthodox Community Centre. But also on Tuesday, from 7:20am to 7:30am, they were at the Espresso Engine coffee shop. From 9:30 at the Woolworths Metro at Turbot Street for 5 minutes. 12:20 to 12:30, JB Hi-Fi at Albert Street, 12:30 to 12:41, the Zara store in Queen Street Mall, and 12:42 to 12:50 at Mecca Maximum Makeup Shop. So we will get more information, but you can see there's a lot of venues there that we're now going to have to go and contact trace. I also need to know whether they're linked to any of our current Delta outbreaks, because of course that's more contagious, or whether to our Alpha outbreak related to the Portuguese Centre. I don't know that yet, so I hope to be able to get genome sequencing by the end of today, which will help then with the risk assessment, which is why I've asked the Premier if we could have another 24 hours of lockdown for Brisbane City because of these 2 cases, because they live in Carindale, but you've heard they've been to a lot of places in West End and the city, and also for Moreton Bay Regional Council because of the airport. We know that that gentleman who's tested positive today through serology has had a lot of contacts. So we really need to look at those 2 local government areas and manage those. So for another 24 hours, I am grateful that people will remain in lockdown and only leave for those 4 allowed reasons. That's really important. Please don't leave Brisbane or the Moreton Bay to go anywhere else. I don't want to spread this virus beyond where it currently is. Now, those other LGAs that have been in lockdown for the last 3 days, thank you very, very much. It has just helped us get on top of this. So now you'll be returning to those previous restrictions, 1 per 4 square metres, maximum of 30 people to your home, all of those ones that I know people are so familiar with, being seated when eating and drinking and so forth. And that will be in place for 2 weeks, just while we work through all of these contacts, because we have a lot of contacts that we just have to work through and make sure we've found everyone. Now, most important of all, I cannot overemphasise this, most important of all, any symptoms at all, anywhere in the state, doesn't matter. Don't think, oh, I haven't had any contact with someone who might be a case. Don't ever think that. Just come forward and immediately get tested, because we've got to find cases as quickly as we possibly can. That's critical. Thank you.
Well, across most of the cases that we've been monitoring this week, this is very good news. It means the lockdown has been working. We just need to give our contact tracers some more time to finish their contact tracing with the Griffin couple and this new case of 2 people in Carindale. Overnight, our hotel quarantine system hit capacity with international arrivals, domestic arrivals from hotspots and close contacts who required hotel quarantine. Today, we are expecting 259 arrivals, including 58 aircrew. Unfortunately, we can't predict how many domestic arrivals will come from hotspots or how many close contacts will need that hotel quarantine accommodation. We know we have 285 rooms becoming available, but it will take 7 days for our police and hotel quarantine coordinators to get a new hotel up and running, and so it's absolutely critical that we see that cut in the number of international visitors, and we would hope that the Prime Minister agrees to that at National Cabinet today.
So thank you to everyone in Queensland for coming out and getting tested in record numbers. We need to keep this up. So as the Chief Health Officer said, no matter where you are in Queensland, whether you're a resident or a visitor, please, if you have any symptoms whatsoever, come get tested. If you are contacted by health as a close contact and told to get tested, whether you have symptoms or not, please find your closest testing centre, whether it's a public or private or Commonwealth site, and go get tested. I've already spoken to my department about testing capabilities around Capalaba and around Brisbane City Council and Moreton Bay to make sure that we have the capacity on any surges that happen over the next 24 hours. We need you to come out and get tested. The only way we can trace and contain this virus is to ensure that we have a very high level of testing, and I thank all Queenslanders for cooperating over this lockdown over the last 3 days and what we're asking of you over the next 24 hours.
Thank you. If I could also start with thanking the community for their cooperation. Overall compliance remains very good. We did see, however, 358 masks handed out in total so far. Yesterday, unfortunately, we saw 4 penalty infringement notices issued, and that included 1 penalty infringement notice associated with the beauty parlour at Newstead, and investigations remain ongoing into that particular matter. And we had 1 arrest associated with COVID, where a person refused to wear a mask and then refused to tell us their details. Not a particularly wise choice. As the Deputy Premier indicated, we are at capacity in terms of our hotel quarantine. The breakdown of that is that we currently have 3,097 persons in hotel quarantine, the breakdown being 753 domestic, 2,459 international passengers. That's across 15 hotels. We are working very hard with health to manage that. So the message I've got to people that are arriving and involved in that, please exercise patience. Our officers and the health workers are doing everything they can to manage this, and they will be there to help you, and we'll keep you advised on how that's progressing. Overall, our borders are very safe. I won't go into all the figures. We're still seeing very low numbers of people having to be turned around, and I just thank the community for their compliance, and as we've just heard, another 24 hours for some, and we ask you to keep working with us. Thank you. Sure.
We've got police officers at hotel quarantine not wearing masks. Are they required to wear masks?
Yeah, look, I'm fully aware of that one and been fully briefed on it. Those officers in that particular instance, and it wasn't just officers or other quarantine workers as well, are completely compliant with the directions. It's one of those things that it's what they would call a green zone with going into technicalities. There are areas within the workplace, as long as they're socially isolated, they don't have to wear the mask.
Is that double standards though, do you think?
No, it's the same for everybody. It's the same for everybody, irrespective of whether they're quarantine workers or any worker.
The Carindale.
Sorry.
It's been a long week. The Carindale mum and daughter, how many other members of the household are there?
I'm getting all that information. This came through in the middle of the night, so I've been working with my staff right through the night. So we will get all of that and put it out there as soon as we've got it.
And there's no idea how they could afford it or where?
Not yet, but look, this has only just come through. So here in Queensland, we report cases each day that come through up to 6 a.m. So we don't have a lot of time to check all this information. You would notice that, for instance, New South Wales cuts off at 8 p.m. the night before, so that they've got more time to collect this. But I think it's important to get this out as soon as I get the information. No, it doesn't, because those people only just came through for a short time in Townsville and then went to Magnetic Island. And really, you can tell, they've managed to not go out broadly. They've been on holidays there, so they've remained there. So it doesn't surprise me. The amount of testing that has been done up there has been absolutely fantastic. So that's why I'm pretty confident.
Do you think it's likely that there are more undetected cases in the community, particularly in Brisbane at the moment?
I don't think it's likely, because I didn't give these numbers, but the testing rate is fantastic. So we did 26,993 tests, which is just amazing, on 26,610 people. So I thank every single one of those. And with that amount of testing, I can be reasonably comfortable that we're unlikely to have a significant chain of transmission going on. So that's why we just need now, because we've got these two people, I'm very, very grateful they came forward. They weren't known contacts. They hadn't been to places that would trigger a thought in someone's mind. They've come forward and got tested, and so now we can go and investigate how they might have got it, where they've been, all of those things.
These lockdowns are very destructive for small business.
Yes.
If the argument is contact tracers need more time, could you not just get more contact tracers, double the amount you have?
We've done all that, but as I said, we got this information. I can show you my phone. I think it came through to me at 1:35 a.m, something like that. We got that information in the middle of the night, and the contact tracers have started. So these poor people have been kept up all night being spoken to. So that's how I've read out that information this morning. And now we have to go and find, so I hope that all of these venues have been using the QR code, because then we can immediately contact those people, and it'll happen very quickly. If they haven't been using a QR code, then it'll take us longer. So we've got plenty of contact tracers. I probably do, but I don't have it there in front of me.
Therefore, worker, you said he's recovered, correct?
Sorry, he's recovered, yes. Yes.
What would it take for the lockdown to be extended further beyond tomorrow?
I need to find out all this information. It's too early to make...
Do you think it'll be extended further?
Well, we've extended it today because of these totally unknown cases, but let's just get through today. It's too hypothetical, I'm sorry. It's a very sensible question. I would hope that it doesn't need to be extended.
A hospital that tested positive, what's the rules for testing? You know how in quarantine they have to be tested once a week?
Yeah.
What's the rules in hospital, and why was her infection not picked up for 10 days?
The same reason that she wasn't vaccinated. So the hospital did not consider her a worker in the COVID ward. So therefore she wasn't getting daily tests.
Dr. yesterday you said that you'll have to focus on second doses for vaccines. Does
Yes.
that mean people who may have booked a first dose might have their appointment cancelled?
We hope not. We hope that we'll be able to manage all of those, but we might have to stop some of those walk-in cases. So people really need to make sure they've got a booking.
And would that be for Pfizer?
Yes.
So we're doing the modelling at the moment.
Are there any initial findings of how that transmission occurred at the Prince Charles Hospital?
No, that investigation was put in place yesterday.
Would you expect that to be finalised?
When they've had a chance to go and investigate, remembering that their key person is a case, so they won't be able to talk to that person till they've recovered.
Are you trying to ensure that admin staff are tested now daily at his outside his COVID ward?
Oh yes, absolutely, yes.
And just on the Delta variant, and obviously we've seen what's happened in Sydney. Are you quite stunned about where we are at now and the position we're in?
No, I'm not stunned by it. I'm thrilled, and I think people in Queensland have just done such a brilliant job to see that amount of testing. And I know some people have had to wait in queues for quite a lengthy period, so to persevere and to do that helps all of us and protects us. And because of that amount of testing, I can make the decisions.
Can I just ask, what would your message be to small business owners,
Yeah.
many of them struggling right now, and these lockdowns seem to be extended based on 1 or 2 cases. We're not going to reach the vaccine targets for months and months. I mean, how do they plan between now and the end of
It's
the year?
incredibly difficult, and it's unfortunately we're in a world pandemic, and no one knew that the virus was going to keep mutating, that we were going to have this highly contagious Delta strain now. And like I've said, we need to get the population vaccinated, and then we'll be in a position where we won't have to do these lockdowns. But until we have the vaccination, this is basically the weapon we have and our app. Sorry. Yeah, thanks for that question. And I had a good discussion with Dr Young about that this morning. And what we would like to see is every Australian who is eligible to be offered the vaccine. And once that happens, then I think that's the critical criteria for the federal government to make a decision.
Is that irrespective of rate?
Sorry, I think you think about it. If, for example, members of your family had not had that offer of the vaccine and the virus came in and they ended up on ventilators, you wouldn't forgive yourself. So I think every eligible Australian should have the opportunity to have been offered a vaccine, and then I think we then need to look at, because what we're going to see in some countries is that some countries will get their population vaccinated and then they'll open up.
Just to be clear though,
yes.
Irrespective of the actual vaccination rate, just as long as the population has all been offered a vaccine, you're comfortable with borders?
Yes, as long as, that's a federal government issue about the international borders, but in terms of, I think everyone would feel comfortable if they knew that every single person in their family had been offered the opportunity for a vaccine.
So you're referring to state borders in terms of keeping them?
Yes. Yes.
Okay,
yep.
Briefly, a baggage handler is supposed to be tested with swab at every shift, from the start of every shift, given the exposure of the dangers of airports?
No, they're not seen. Sorry. No. Remember that the Commonwealth Government manages and owns our international airports, so it's really a question best put to them. I've certainly offered that everyone who works at our international airport get vaccinated, and I know a lot of people there have taken up that offer, and I'll continue to push that offer. No, we don't test every single person who works at the international airport every shift. We test the border workers, so those people who knowingly have interaction and have to manage those international passengers as they come through, but we don't test the baggage handlers.
Just to clarify, people who say work in Brisbane but then live in Logan, do they follow the Brisbane lockdown or the Logan lockdown?
So it's if you've been in that LGA, you're covered by that. So people one of the reasons you can leave your home, of course, is for essential work that you can't do from home, but otherwise you can only leave for exercise, caregiving responsibilities, healthcare and purchasing essential goods.
Yeah, your mum and daughter, were they symptomatic?
Yes, yes, exactly. They're brilliant. Yep, they're really good.
Oh, sorry. Sorry, I didn't see you over the lectern, Jack. Something about my height.
Yeah. Have you been able to guarantee that every worker in the COVID ward is now, or outside COVID ward is now vaccinated?
So again, my hospital and health services have assured me that the 1A group continue to be vaccinated, those working in the COVID wards. As I say, this young lady, there is a dispute as to whether she is deemed to be part of 1A because she didn't work physically inside the ward. She worked in a separate area, and we'll work through that. But what we've said, and we wrote to the 5 hospitals yesterday, saying why should we not extend our 1A definition to include everyone, admin staff, cleaners, wardies, doctors, nurses who work in the entire hospital precinct if they have COVID patients in those hospitals, so those 5 hospitals. And I welcome what I've read this morning, the AMA and the Nurses and Midwives Union saying they support that and want to work with the government about what we do with those who can't, for health reasons, they may be pregnant, other reasons can't get a vaccine, whether they be redeployed to other hospitals and that. But we'll work through that. We'll put that offer out to those 5 hospitals. In the meantime, we are ramping up our capabilities at those 5 hospitals over the weekend to make sure every health worker who wants it at those 5 hospitals can get it. But I can tell you right now that every one of those 5 hospitals are basically 70% or above already first dose, and we've got very high rates of second dose across those 5 hospitals. So,
they're ensuring that unvaccinated people aren't working in the COVID wards at the moment?
I've been assured of that, but I'm also asking them to show me how they satisfy themselves of that assurance. So I'm being told yes, that they are meeting all the directive requirements, but I am asking those hospitals and those hospital and health services to show me that. Can I just, because we didn't mention this yesterday, we do have one of our COVID patients who's in ICU now from the Portuguese Family Centre. So thankfully this person, I believe he's 69-year-old male, is not on a ventilator at this point, but he is in ICU. So I just want to, our thoughts go out to him and his family right now at this time.
Is he the manager or the owner?
I'm not sure if he's the manager. We just know he's a gentleman associated with that. Thank you.
How is vaccine supply at the moment?
We're doing the modelling right now. We'll have more to say in that in the next couple of days, but we're going through the modelling at the moment about how much vaccine we have on stock, the bookings we've got for first doses, and the number of people who are due to have second doses over the following weeks.
People on the wait list to get a vaccine who have registered but haven't had an appointment? Has that been...
I've asked for that number. I've got the other numbers coming in about how many are due for first dose, how many are due for second dose over the coming weeks. I've also asked how many are waiting on our waiting list who have registered an interest.
Gotta go.
Thank you.
Thank you.
Thank you. Thanks very much.